Thank you very much. I am really thankful to administration of Liaquat University for inviting me to give this talk. One of the very important thing, if you see hidden burden, मैं जब इस हॉल में आया तो सबसे पहली नज़र मेरी इस पोस्टर पे पड़ी और इस पोस्टर पे एक लफ्ज़ लिखा हुआ है, शादी से पहले एहतियात कर लें। ये जुमला जो है इसने मुझे याद दिलाया, अब से 30 साल पहले एक कोएक है, उसकी क्लिनिक में मैं गया था और वहाँ पे ये जुमला लिखा हुआ था और उस पर एक शेर की शक्ल में लिखा हुआ था और वो शेर मैं आपके साथ शेयर करूँगा ताकि आपको हिडन मैसेज का अंदाज़ा हो जाए कैसे। ये मिर्ज़ा माहिर बैग माहिर हैं, रेनबो सेंटर में उनका क्लिनिक है। अगर आप भी जाएंगे तो उस क्लिनिक के बाहर एक लिखा हुआ है कि अगर चाहते हो नदामत से बचना तो शादी से पहले मुलाकात कर लो, बस इतना लिखा हुआ है। एंड यू अंडरस्टैंड द मैसेज हिडन इन दिस। तो हिडन चीज़ ऐसी होती है कि कोई एक चीज़ हो। सिमिलरली द हिडन बर्डन यू आर टॉकिंग अबाउट एनीमिया, तो उसके बारे में अगर हम बात करें, क्योंकि अप टिल नाउ आई मीन वेरी स्कॉलरली टॉक्स हुई हैं, बट इफ़ यू वी लुक एट द हिडन बर्डन तो उसमें सबसे पहले हिडन बर्डन बेसिकली दैट डिपेंड ऑन सीवियरिटी ऑफ एनीमिया, अंडरलाइंग कॉज ऑफ द एनीमिया एज वेल एज management of that anemia, and there are many burdens that we need to understand. First of all, in anemia basically there is low iron carrying capacity, and because of that low iron carrying capacity the child have the low energy, and because of that he has difficulty in engaging in normal activities and difficulty in playing with the friends. And second thing he feels fatigue and his mood is being affected, and most of the child become irritable. But most important of these is these child who have the low oxygen carrying capacity. Because low supply of the oxygen, their cognitive abilities are going to be jeopardized, and then cognitive abilities get decreased, and because of the poor concentration of oxygen their registration rate is come. They have difficulty in registering thing. When they have difficulty in registration, what is going to happen? They are not going into their memory, and because of their academic performance that is going to be decreased. And because of that, most of these children who are suffering from anemia, they are going to develop low self-esteem and many of the psychological problems. Emotional disturbances living with the chronic condition, anemia हो या कोई भी condition हो, all chronic condition they cause emotional distress because the feeling of different from the other people. These children, they feel they cannot participate as the other children participate in activity, and they are anxious about the treatment, and they are frustrated, and this frustration is going to make them more emotionally disturbed. Most of the time these children who are suffering from anemia from any cause, they feel social isolation, inability to participate in physical activity, sports, games. That's why they feel social isolation, and because of this social isolation they feel lonely. And not only lonely, a sense of missing important childhood experiences, which is very important for his future life of that child. तो वो इवेंट जिसमें उसको पार्टिसिपेट करके बहुत सारी चीज़ें लर्न करनी थी, if his anemia is not going to be treated, they remain deficient, and that is going to affect the future of that child. That's why it is important that these children need to be treated as early as possible. Stigmatization is another important aspect of the people who are suffering from the anemia, those children, because of their pale skin, weakness, and other visible signs of the anemia, and that because they feel they are different, they are being stigmatized, and that is going to affect their emotional health and going to disturb their self-esteem and social development. Besides children, these children who are suffering from anemia, they are burdens for their family, and the family parents have experienced significant stress, worry, and they feel guilty. Many of these parents feel guilty because this illness is because of them. Many a time they feel guilty because of they are unable to help their children. And once mothers are going to be affected, this mother's mental health is not, important for the children, but for other children. Why? Because once mother are going to be disturbed, the other children are going to develop the cognitive deficit. In a one study that we conducted in a pediatric ward, what we did, in the postpartum females, we screen out those female with Anemia postnatal depression scale. So what we found that more than 60% of the female in a postpartum period, they were suffering from depression. So what we did, we observe those children. So what their children were, most of 70% of the mothers having their children who are underweight. And how they were being treated, they were treating by different, formulas, nutrients, multivitamins. So what we did, we divided those mothers into two groups. In one group, basically we keep them as the treatment as usual. While in other group, we introduce a learning through model of the Toronto University, in which no medicine was given, but just to involve those female in activity, interacting those children. So sessions were being conducted. There were 12 sessions weekly. And in those sessions, there were LHVs and psychologists. Basically, these are not the doctors. They were just involving those mothers just to talk to the child, play with the child, and have interaction with the child. And I used to observe those sessions. Many of the women from the Liari side, they used to say, Dr. Sahab, ajeeb aadmi hai, chota sa bachcha hai, main isse kya baat karun? So they used to say, no, ye understand karta, isse baat kare. And you see, after 12 weeks, we compare the mental state of those mothers increase. But when the mother's mental state increase, our target was the weight of the baby. We compared those babies who are being treated by this learning through play model with those babies who are being receiving treatment as usual. Their weight was statistically significantly increased. What does that mean? That by improving mental health of the mother, we can target. So when the mental health of a mother is going to be affected because of this anemia, that is going to have a drastic effect on mental state of other children also. And there are a lot of literature about that. If the mother is going to have psychological problem, the normal children, they are going to have the cognitive deficits. So that's why it is very important that we need to understand this. We must treat it. Besides that, this anemia, basically, it is a financial strain for that family. And treating anemia is very expensive. Frequent medical appointments, laboratory tests, medications, and all these are going to create a financial strain for that family, and their family become stressful. So that we need to understand that. And because of the anemia, disrupt daily routine activities of the child and the family, and because of that, parents' ability to work, that is going to be jeopardized, and parents' attention towards other sibling, that is going to be affected because of their mental state is going to be affected, and overall quality of life of the whole family is going to be affected only because of anemia of a child. That's why it need to be addressed as early as possible. Families need to be advocate child's health, negotiate healthcare system, and educate themselves about anemia and all these additional responsibilities, because beside the household chores, they are going to create an additional stress to the family, and that family is going to be stressed. So treatment compliance is very important. Ensuring adherence to treatment plan, taking medication, iron supplement, whatever treatment for that anemia is being given, they remain to, and this is a challenge and stressful for the families, not only for the child, and non-compliance is going to create a lot of guilt and frustration in the family. That's why it is very important that we understand. So if we see the long term, what are the effects that is going to have anemia? If the anemia, it is going to impair cognitive, psychological, and motor development of that child. If these are going to be affected, that is going to create behavioral problem and growth retardation. And this child, in adolescent, it is going to have a lot of cognitive and behavioral problem. And in future, when he is going to become adult, what is going to happen because of these deficits? What is going to happen? Its IQ is going to decrease, its motor skill, its concentration, school performance, and global development is going to be affected. And because of that, when he is going to be, employed, he is going to have low wages, GDP is losses and daily losses. So that means there is a permanent financial strain on whole of the family if the child is going to have anemia during the childhood. So what is the way forward? The way forward to address the psychological effect, it is important to provide comprehensive medical care and the emotional support to the children, that we need to understand. And besides that, health professionals should effectively communicate with the child and the family, try to understand, try to explain to them that this is a very important period, and most of the cognitive development, they are going to occur in first 4 years of the child, that are the most crucial period. Helping them understand the condition and its management. In this regard, support group, counseling services are valuable resources for the children and their families to cope with the emotional challenges. So anemia is very important, and interestingly, if you want to address this hidden burden, then to address that or to treat that, you basically are not going to address children. These things can be addressed only by addressing the adults, the family members, that you are going to counsel them, that how they are going to, improve their their environment. And most of the time, many of time, it is very common, the children are coming to my clinic and with a behavioral problem. And believe me, 90% time when I ask them how much time the parents are going to have with the child, 90% of the time they say that we are not going to spend much time with the child. And what we do, we simply advise, and I'm just advising you that once you see that it is going to happen, ask them to start spending time with the child. Ask them to have communication with the child, and ask them to, remain away from this child. So this is the best thing and many a time I'm sharing with you that most of the mental state of the children that is going to improve by that. So this is a way how we can address, we can talk, but I am seeing that this time is already over. So I cut short over here and stop here. Thank you very much.